Hello, everyone. Today, we are going to discuss Beyond HIPAA, future proofing healthcare data privacy, exploring AI's role in protecting PHI, protected health information. This is the structure. We will talk about framing the problem, HIPAA today, strengths and gaps, cyber threats and breaches in AI era, AI as a defense mechanism, ethics, bias, and responsible AI, future trends, and of course, call to action. Then we will have a closing. So today we have a special guest joining me, someone I deeply admire, Joe Clemons, a seasoned healthcare IT executive and a thought leader in digital trust, cyber security, and AI governance. Joe, thrilled to have you here. Welcome to
Well,
this one.
thank you so much, Dr. Sahu. It's a pleasure to be here with you today and to talk about this really important topic. You know, data privacy, especially in healthcare, is reaching an inflection point. HIPAA laid the foundation, but it's time we look forward to much more intelligent and adaptive and AI enabled devices and defenses. So I'm excited to explore that with you today. You know, I think to get started, it would be really good for us to kind of frame the problem that as we see it for the audience. I think it's important that we ground in some very unfortunate but harsh reality. In 2024 alone, the healthcare industry suffered over 700 data breaches, exposing the PHI of more than 90 million people. This isn't just a compliance issue. At the end of the day, it's a trust issue. When I think about when I get an email, for example, from a vendor that I use, like a hotel chain or a credit card company, and I get that letter in the mail that says, hey, we want to let you know that our data has been breached and your stuff could be out there. It's a violation of trust at that point, and it's no difference in healthcare. So, we're facing more than just phishing emails or ransomware. We're facing nation state attacks, deep fake enabled identity theft, and AI generated synthetic data fraud is becoming even more prevalent and really scary. And HIPAA was not really designed for this level of sophistication. If you think about it, HIPAA came, as a result of the late 90s. So it's sad to say at this point, it's not a matter of if a breach is going to happen or you're going to experience one. It's a matter of when. And really the question is, how do you respond to it?
Absolutely well said, Joe. And yet, the cost of breach is more than financial, right? It
Mm-hmm.
affects outcomes, delays care, and erodes even patient trust. Trust is a major concern, right? So we are moving from a system of reactive defense to proactive, that is AI-driven resilience. So let's talk about HIPAA today, its strength and gaps. HIPAA is vital, we all know that. It establishes standards for safeguarding data, but it is reactive. Like checkbox driven nature is now
Mm-hmm.
up to some limitation. It's static in a dynamic threat landscape. So where HIPAA fails sought in real-time visibility, predictive threat detection, and automated response. So what is your take on it, Joe?
Well, I think the big thing that you said there that it resonates with me and will resonate with most people in healthcare, both clinicians and non-clinicians, is the need to be proactive. We'll talk about this a little bit more later, but you're exactly right. HIPAA tells you what to do, but it doesn't tell you how to do it or how to intelligently adapt. It assumes that there's a fortress mentality. It assumes that everything's going to go perfectly, but attackers are already inside the gate and they're using AI too. So HIPAA is very important because it gives us the expectations of keeping things safe. But what's missing there in a lot of organizations is how do we do that? You'll probably, folks that are listening, you probably have an annual or a quarterly or a biannual training that you have to go through just to remind yourself around the basics of HIPAA. Well, these bad actors are way smarter than that. They're always trying to figure out a way to get around it. They really don't care about whether or not we are preserving the data the way we're supposed to. They're trying to come at it in a way that's very unique. So I think we should switch gears and talk a little bit about cyber threats and breaches in this era of artificial intelligence. So if we talk about adaptive cyber threats, today's attackers are using generative AI to craft highly personalized phishing campaigns, manipulate medical images, or even create synthetic patient records. It's just like how we go today to like Chat GPT or something to say, here, craft this message for a birthday card or something like
Yeah.
that. They're using this same technology to get very crafty around how they're trying to use phishing campaigns, for example. And you have to be very diligent because even the we're moving so fast sometimes, it's very easy for us to click on a link and think it's real. So this isn't hypothetical. In some cases, malicious AI models are trained on stolen medical data to simulate biometric patterns for spoofing. In other words, there's a tremendous amount of honing skills and many different angles of attack that we have to be ready to mitigate.
Spot on. And let's not forget supply chain vulnerabilities, Joe, like
Mm.
third-party apps with access to PHI, let's say IoT medical devices with weak encryption, right? All of these are entry points, and AI gives us an opportunity to plug those gaps. So let's talk about a little bit on the AI as a defense mechanism. So see how AI actually help. Think continuous risk scoring of access request or
Mm.
anomaly detection system that flag subtle deviation in usage patterns long before a breach happens, right? And we have been seen hospitals deploy federated learning models to share insights across institutions without sharing data, or a great example of, let's say, privacy preserving AI. So what is your take on it, Joe?
Well, just like the bad actors are using AI to help them, we can be smart about it and use AI to help defend against those type of things. I love that concept. Add to that natural language processing systems that can parse audit logs in real time, way faster than any human could do it, or reinforcement learning models that adapt to new attack vectors. But this has to be coupled with the ability to be able to explain it. And like everything else that we do, it must have good governance. We can't protect patient data by creating black boxes and just simply thinking just the AI would take care of it. There still has to be a human component about this to be able to have a translation, be able to explain things, and again, governance is where it's at. When we think about governance, that naturally transitions us to talk about things like ethics and bias, and how are we responsible in AI? AI is relatively new in the healthcare space, and while we are seeing the promise of it to help, with some physician burnout and things like that, it also is moving very fast. And as you know, and people that are in healthcare know, healthcare moves slowly sometimes, and so it's important to understand that in order for us to be able to make good progress, we have to do it responsibly. So privacy and fairness go hand in hand. If we imagine an AI that incorrectly, for example, flags minority patients as fraudulent due to biased training data, that could be a real problem.
Yeah.
We must ensure that our models are trained with representative, de-identified, and consent-based data sets. So in a lot of ways, we're trying to treat how we approach AI the same way we do with HIPAA in general, which is we must make it so that it is de-identified and follows those areas, or else we could help contribute to the problem.
And transparency by design, Joe, let's say regulations are evolving, right? Think of the EU AI Act or US executive orders on AI. But ethical leadership must come from within healthcare systems, not just policymakers, right, Joe?
Absolutely, I agree. I mean, if you think about it, we just talked about HIPAA. They tell us what to do, but not how to do it. This is kind of the same thing. We have to have some ethical leadership in how we're going to approach this. It's not just about compliance. It's got to be about compassion. It's got to be bringing the humanity into artificial intelligence. Patients are more than records. Patients are more than just a number. Behind each of those numbers is a person that had a reason to go into the hospital. And, we owe them systems that they can trust as much as possible.
Absolutely, absolutely, absolutely. Well said. So let's talk about a little bit on the future trends and what should be the call to action for our audience. So let's say the future is AI, human intelligence, working together to protect privacy. Expect to see blockchain for, let's say, audit trails, quantum safe encryption, and AI models that self audit. So I want to understand from you on the future trends. Yeah, Joe.
Yeah, there's definitely a lot of new roles that are opening up in healthcare organization, and I would say it's based on the spirit of collaboration, because typically people that are experts in this particular area are very specialized, and so they've got to work together with a team. So more collaboration between cybersecurity in general, so the CISO, data science, so chief data officers, and also clinical teams. We're talking about the chief medical officer, the CMIO, chief medical information officer, chief nursing information officer. All of these C-suite roles have to work together. And we're seeing a lot of new roles that are coming out of this. We're seeing a lot of chief AI ethics officers, chief digital officers that also focus on this area. But what we're also seeing is, especially in the data and analytics space, where analytics, we're doing a lot to create it, but we also need to do a lot to preserve it. So there's a lot of new trending roles that are coming out around this, especially in the C level, but also all the way down. And it's really important that these teams really work closely together.
Absolutely, yeah, absolutely. And our audience, if you are in health tech, now this is the time to invest in AI for privacy, not just
Yeah, and it's
performance.
also important
Yeah,
not only to get in it, invest in it, but it's also time to build systems that are not just smart, but also if we think about them as sacred, because nothing's more personal, than our health. So I think at the end of the day, there's the business tactical side of this where we have to check the boxes to make sure everything's secure, but at the same time, there's the why, the all important why. Why are we doing this? And this goes back to that original topic at the top when we started talking about trust. And we've got to have the trust of our patients, because if we lose that, it's really hard to get back.
absolutely well said. Thank you, Joe, for an inspiring and sobering discussion we had today. And from everyone watching, if you are a healthcare leader, technologist, or policymaker, this is your moment to lean in. Follow Joe and Data Safeguard for cutting edge insights in this space. Let's keep this conversation going in the comments. Until next time, stay safe, stay smart, and stay human. Joe,
I
what is
love
your
that
closing note?
ending that you have there. Stay safe, stay smart, and stay human. Human is really important.
Yeah,
Thanks again, Dr. Sahu. It's really nice to spend time with you this morning, and to everybody watching. Let's not remember. Let's remember. Let's not remember. Let's not forget that it's not if, but when this is going to happen, and that privacy should not be and cannot be a barrier to innovation. It's the foundation of trust. So let's protect it together. We can do it. And just like in healthcare, as I mentioned at the top, clinicians work diligently on prevention. We're trying to keep people from coming into the hospital. We're trying to keep them from getting sick. So prevention is a big part of it. And data safeguard solutions are a premier way to get ahead of these types of problems and mitigate risk and help you and your organization rest easy and stay focused on what's important, which ultimately is the patient.
thank you. Thank you, Joe. Appreciate. I think I had a great
Yeah.
time with you today. I'm sure we will have a lot of comments and we will try to respond to you back. Audience, if you have any comments, please feel free to write on the comments button and we will respond to you back.
Thank
Thank
you.
you, Joe.